Hello everyone, my name is Karina and I will be presenting today with Dakota and we will be doing a presentation on ALS. Now what is ALS? ALS is a motor neuron disease that is rare and progressive, primarily affecting the nerve cells, specifically the cells responsible for controlling voluntary muscle movement, which is again the muscles we choose to move to produce movements like chewing, walking, talking. ALS stands for amyotrophic lateral sclerosis. To break it down for you guys, amyotrophic comes from the Greek language. A meaning no, myo meaning referring to the muscles, and trophic meaning nourishment. Lateral refers to the area on a person's spinal cord where nerve cells are located. Sclerosis means scarring to the body. And if we put it all together, ALS means no muscle nourishment in the spinal cord, which leads to nerve cell scarring. Now, motor neuron diseases are diseases that cause degeneration and death to the motor neurons. Motor neurons are the nerve cells that extend from the brain to the spinal cord and also to muscles all around our body. In ALS specifically, the progression of the degeneration of the motor neurons eventually leads to their death. As the motor neurons die, they stop sending messages to the muscle and they then weaken, leading to the brain to lose its ability and function, and control voluntary muscle movement is lost throughout the body, especially the muscles in the arms and the legs. As you can see in this picture, on the right, how nerve cells are degenerating and wrinkling up as sclerosis does damage to the muscle as the contracts weaken more and more, compared to the nerve cell on the left, which is normal and the muscle is contracting normally. When it comes to ALS, there are two main types, sporadic and familial. About 95% of people are affected with sporadic ALS, which is the type of disease that is said to be occurring at random with no clear associated risk factors or family history. With familial ALS, about 5 to 10% of all cases are found to be within this type, and it is said to be caused genetically, specifically from a parent. It is said that it only takes one parent to carry the disease-causing gene to be at risk. There are more than a dozen mutation genes to cause ALS due to the process of RNA molecules changing, causing motor neuron degeneration. Here I will talk specifically about two genes, C9orf72 gene, which is the gene that makes up a protein that is found in nerve cells and motor neurons in the brain, and SOD1 gene, which is involved in the production of enzymes, specifically copper zinc superoxide dismutase 1. Now, it is said that 25 to 40% is found in familial ALS, and a small percentage was found in sporadic ALS, and 12 to 20% is found in familial cases. Now, these are the two genes that are mainly found in ALS and are linked to it. Now, who is said to be at risk? ALS can basically strike at any age and increase with age as it progresses. The most common ones at risk are the ages between 55 and 75. It is also found that it is more likely to be found in men and women, though as the age increases to the 50s and 70s, the differences in age doesn't really matter. It is also said that military service people are about twice as more likely at risk to get ALS due to exposure to things like lead, pesticides, and other environmental toxins found in the environment that they are in.
Hey guys, I'm Dakota. I'll be doing the rest of the presentation. There we are. First, I'm going to talk about the symptoms of ALS to continue. The symptoms, they normally start pretty minimal and you don't really notice that anything's too wrong. It can start with tripping, falling, being less, just less agile than you were before. And all the symptoms generally progress throughout the disease. So at the beginning, there's less muscle degradation, so the symptoms won't be as severe. But as you kind of go through the disease, they'll get worse and worse, and they generally lead to paralysis. And the cause of death for this is actually normally respiratory failure because they aren't able to get all the oxygen they need. So the symptoms can be cognitive and behavioral changes, slurred speech, weakness in extremities, trouble swallowing, inappropriate crying, laughing, or yawning, and like I said, paralysis. What was surprising to me when I was researching this is it normally has minimal pain. It said that there's almost none during the first stage of the disease, and then at the end it's very minimal. But it said how that was due to some of the nerves being degraded as well. So you can't really feel pain if your nerves aren't working as well as they should. So next, the diagnosis of this disease is, it's normally not a test that says, oh yes, you're positive for this. It's going through other tests for other diseases and them coming back negative, and then you can conclude that you have ALS. So sometimes they do an electromyogram or an EMG, and you put needle electrodes into your skin, and it can test into the muscle under your skin, and it can test the electronic activity of your muscles. Next can be a nerve conduct study, and those can test whether your nerves are damaged or not, or it could be an MRI, which the picture right up there is a picture of an MRI, but it can, it maps out your brain and your spinal cord, and it can show a picture of if it's been degraded or not. So then treatments for this disease are a couple medications. The two main ones that I saw were Riluzole, which it increases life expectancy by 3 to 6 months on average, and Edaravone, which it wasn't really, there was no conclusion on whether it lengthened the life expectancy, but it reduced the declining of the disease in people. You can't go back in progression of the disease, but you can slow it down. And finally, the average lifespan after diagnosis of this disease can be 2 to 5 years on average. And there are the references. Thank you for watching, and let us know if you have any questions.